Hi, everyone. Welcome. I'm Angela Love-Zaranka, Program Director for Lactation Education Resources.
And I am Sekeita Lewis-Johnson, Accredited Provider Program Director for LER, which is Lactation Education Resources.
That's us. Thanks so much for joining us today. A little housekeeping we'll get started with here. But first, let me just do a brief introduction of myself. So I am a board certified lactation consultant. I have been working in community support for over 30 years, board certified for over 25. I've worked in a hospital setting, private practice, as well as support in my local community, which is right outside of the Washington, D.C. metropolitan area. How about you, Sekeita?
Yeah, thanks, Angela. I am a board certified family nurse practitioner, lactation consultant for now 15 years, and a birth doula. I too have provided lactation support and care in a hospital setting, in a community setting, and I am just happy to be here to present some of my knowledge and realities of being and becoming an IBCLC.
Excellent. Thank you. So if you would like to ask us questions or to make any comments, feel free to navigate this GoToWebinar platform. If you're participating today on a desktop or a laptop, take a look at the blue arrow and it will show you where you can type in your questions. And questions and comments, it's the same thing for us. If you're on a mobile device, it can be found along this bottom bar of the app. And note the question mark there as indicated by the green arrow. So joining our webinar today is Jill, who can provide tech support, as well as Julie, who is an IBCLC and part of our amazing customer support team. So they're keeping an eye on the questions. They can answer them in the chat if you need any sort of support, and they'll leave a few for Sekeita and I to answer live. So please do type into the question box, where are you participating today? We'd love to know where you are located in the world. If you have future questions and need to run off, you can send them to support@lactationtraining.com. So now let's dive in and take a closer look at what a lactation consultant is and how you can follow your passion and become one. If you decide to become an IBCLC, you will join more than 35,000 IBCLCs in over 131 countries. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Examiners. Take a look at their website. They have different regional offices depending on where in the world you reside or work. Review the requirements and pathways to become eligible to take the IBCLC certification exam. What do you need to know? The detailed content outline or exam blueprint is based on surveys of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and chronological stages an IBCLC needs to know in their work. LER courses cover the entire detailed content outline, and our courses are approved by LARC. That's the organization that evaluates and approves lactation consultants training programs. Sekeita will review a few questions to ask yourself today. Sekeita?
Yes, thanks, Angela. So before we take a deeper dive into what's real, what are the realities, I want you to take a moment and either write these questions down or really think about them as we're going through both parts of this presentation. So the first question is, do I have the skills? And you might first think like, well, that's why I'm on this call, right? I don't know if I have the skills. And that's okay if you don't have the skills. We're just going to talk about the skills that are critical and necessary to be an accomplished and a competent IBCLC. The next question you want to ask yourself is, where will I get these skills? And that's going to be critically important as we think about the actual what you need to do in order to sit for the exam. So if you don't have an idea of these two questions, that's quite okay. Just really write them down and then think about them, reflect on them, and use them to make a plan. All right. So you just heard me say competent. And just a few seconds ago, competency is the ability, the skills, and the knowledge to master something successfully, to do something successfully. Now, when I think about competency, I think about it sets us apart from, I should say, it sets us apart from those who will do something based on their own experience, their own, particularly as we're talking about lactation and breastfeeding and chest feeding. Folks will often rely on their own experience as a level of competency. But you have to keep in mind when you are working with families, families will come with all different health histories that are not like your own. And so being a competent IBCLC is recognizing that there is a foundational knowledge and there are foundational skills that we must have when we work with families. And so we have to have also the abilities to, if we don't know something, to really go and research that thing and look it up. But I'll talk a little bit more about that later. All righty. Culturally appropriate, incredible. Culturally appropriate, let's unpack that first. What it, when you work in healthcare or even, what, I've heard this even in the corporate world sometimes said, the notion of cultural competency. And so I want to challenge that. I'm not sure if we can ever be competent in someone else's culture, but we can definitely deliver culturally appropriate care through delivering care that is wrought with cultural humility. So when we think about, sometimes we have these stereotypes that we think about cultures. There's one culture that, well, let's just take African American women. Sometimes folks are like, oh, they don't do that in their culture. They don't breastfeed, which is absolutely not true. Some people don't breastfeed in certain cultures, and that's throughout every culture, right? So also we want to think about, being clear in our use of language. There are cultures and then there are subcultures. So we can't make assumptions about who a person is just based on the outside and how they may look or speak. Along with being culturally appropriate, you want to make sure that you are credible. Are you a credible resource? Remember, I said, don't go off your own experience. Sometimes we try to answer questions based on a whim, based on something that, we absolutely don't know. And it's okay to say, you know what, let me get back to you. You don't even have to say, I don't know. You can say, let me get back to you with that question. That's a great question. One of the things is if you answer a question and you are totally wrong, what happens is not only do you lose credibility as a lactation consultant or provider, so do other lactation consultants. And so you really do want to be a reliable clinician. So being reliable means you're giving out information that A, coincides with the best evidence, and B, you really know what you're talking about. Policy advisor and creator. So a couple things that we do as IBCLCs is we advise on policy. We actually help create policies. And that's important to know from the standpoint when we're talking about clinical care. Remember when I talked about skills, do you have the skills necessary? Some of you on this call may already have skills in policy creation or policy advisor or even analyzing policies. And I'm like, yes, yes, we need you. We need more of that, particularly in this profession. So, you know, that's a strong suit to have, but let's just say that it's not your background. That's okay too, because one of the things we do is we sit and we listen as IBCLCs. So maybe we're not informing policy, but maybe we're at the table listening to it. We are stakeholders. So we should be there learning about policies that are related to the families that we serve. So that's okay if you don't have policy as a background, but I do want to say that policy informs our advocacy. It informs how we move. So it's a big part of who we are and what we do. And it really being an advocate is just that you are publicly supporting or recommending a particular cause or a policy. So if you're not a policy advisor, so to speak, you can be that person at the table listening to how policies are created and sharing your perspective of each policy or those policies. So being a problem solver is about 90% of what we do. Remember, each family comes with their own concerns. So when we're called to support, it's usually a request for someone who is having some challenges, and they may be having challenges with breastfeeding, chest feeding, or just a question about lactation. So you want to be mindful of framing concerns, lactation related concerns, I should say, from an all size fits all framework. As you'll learn in any type of clinician work that you do when you're working with people, one size never fits all. So we should really be using an individual, looking at folks from an individualized lens of their particular concerns, what the family is sharing with you, and being that problem solver, also centering the families as the expert in that problem, but you as the person that's kind of sort it out and be of assistance. So researcher, all of us will become researchers. If you're on this journey of learning, you will have to look up certain things. And that's all I'm talking about when I say researcher, is this really, if you can see in my background, there are several books. I still have to rely and look up things, right? But we also have lactation consultants that actually do research. In the lactation profession, there is so many things that knowledge gaps, I should say, not things. There's so many knowledge gaps that exist that we're trying to close, that we want to know more about. Human milk is so wonderful. And so if you ever read a research journal about human milk, you've researched that thing, right? And so, there's two ways to be a researcher. There's the academic portion, the academic research that is truly a little bit more rigorous than, let's just say, me reading an article and critically analyzing that. But if you are an IBCLC, it behooves you to keep up with research, to read the literature, because that's how you stay up to date with the latest evidence, and it informs your practice with your patients and clients. All right. High level skilled lactation care. There are, you will notice that there are many different um, certifications and credentials of lactation providers. What sets the IBCLC apart is the ability, the skills, and the knowledge to deliver high level lactation care. So, when I say high level lactation care, well, what do I mean by that? I mean that, you know, it is beyond the uncomplicated. It goes and extends to the complicated. And sometimes when we think about complications, we think about them in just one, like there's just one complication. No, it may not be, right? Because there is a parent and then there is a child. And what if both are having some challenges, with lactation? And so, with that being said, high level lactation care is the difference. Coming out as a novice, of course, you will have the foundational knowledge, right? And you should have experience in some of the complications, right? But you may not have all of it. But again, just strive to understand that the duty of IBCLCs is to be able to become that expert in the feeding and the management of clinical lactation. And that's where your skill come in at. When we think about levels of care, there is a scale, a lactation acuity scale that was developed in 2011, and it talks about a level 1, a level 2, and a level 3. IBCLCs, we deliver level 2 and 3 care. That is the model. And if you want more information, you can certainly look it up, and you can start by reading that research because it's really a good framework for how to practice and how to deliver equitable care. All right, essential and timely. I think we can all agree that we've probably heard the word essential much more in our lifetimes than we've ever heard them when the pandemic hit. One of the things that we found out is, it became this buzzword. But those of us who are working in the lactation field, we really know what this means because we are essential. Babies were still being born, people were still having children and are still having children. And especially during a pandemic, it got a little rough there. But we had to stay the course and stick in the trenches because otherwise families wouldn't have had any support. So when I say we are essential, it was really a learning curve of how to deliver support during uncertain times, during scary times. You know, just because it was a pandemic, it didn't mean we weren't IBCLCs, right? And more than ever, folks were reaching out. And so that's where it becomes timely as well. Timely means you are delivering the care at the time that it is necessary. Now, I'm not saying that, somebody calls you and you're at home and it's 3 and they're saying, I need you at 4 and you jump up, whatever you're doing. That's not what I'm saying. But our response to families to talk to them about their concerns, to develop a plan, even over the phone if you have to. And then if you have to be in public or you can do telehealth, but that you get to the family before they're in a full crisis and before their goal of human milk feeding their child just is non-existent. So that's what I mean as being essential and being timely. During the pandemic, there was a level of let's all do telehealth. And I'm just going to remind some of us that yes, telehealth is good. It is a great tool to have. However, the need to see families, to meet families where they are when telehealth does not work is also a real thing. And so it's truly, we are there to provide accessible care at the time that it is needed. And that's the way to get the best outcomes for families. Collaborative care partner. And I will reverse those and say trusted collaborative care partner. I love this phrase a ton because it assumes that you are collaborating with your client. There is also a word that you will hear, particularly in healthcare, called shared decision making. And in some instances, I would argue that we don't share the decisions with families. It is their decision to make as the experts of their own care. However, I want to just say that, you know, the other thing that this term assumes is that we are not the center. I am not the center. I am not the decision maker. You are not the center. You are not the decision maker. You are the collaborator. So remember that it's the family and their partners, their goals, their fears, their barriers that takes precedence over your goals for them. So I'm saying that to say, yes, we all know their recommendations, exclusive breastfeeding for at least 6 months, at least. We know those things, right? And it's important that we still honor those and we still talk about them and we still educate and we still share. However, we also have to understand that we are in a collaborative partnership and agreement that when someone seeks our care, that we make sure that we approach it in a manner that we don't overstep boundaries that are not meant for us to overstep. And that's how you become trusted. In all honesty, that's how you become trusted to do no harm, to be reliable, trusted to say that, you know what, I see you as a person. I see that we're in this together. I am not higher than you. We're collaborating to do what is best for you. When you go into certain clinical relationships and assume an hierarchy, like, yep, I'm the expert. I'm gonna come in. I've been teaching breastfeeding, chest feeding for 25 years. I'm gonna tell you how this should work real quick. Okay, here's a baby. Boop. You are going to lose trust, no doubt. The other thing is when you go in and you just touch someone without asking their permission. Let's just say you heard they wanted help with latch assistance. Let them tell you the type of assistance they were looking for before you just go in and just start touching. That's how you become trusted, right? You're there in a collaborative spirit. Now we're going to move to person-centered care because remember I said we are not the center, right? My ideas, my goals, my values, it is the person that is the center. And you've heard me talk about collaboration. You've heard me talk about culture. You've heard the word care and communication. And the person is at the center of all of this. So the Institute of Medicine defined patient-centered care as providing care that is respectful of and responsive to individual patients' preferences, needs, and values, and ensuring that patient values guide all decisions. And so I wanted to just leave you with that notion and also this visual that centered around the person are all of these factors: communication, collaboration, care, and culture. And we are on the outside of that, delivering care in a way that is culturally appropriate. All right, so I began with two questions. I am going to end with a few more questions before I turn it over to Angela. So, Angela's going to start to talk about pathways. It's important for you to consider when she's talking about pathways. Well, first of all, before I even say what to consider, listen to each pathway carefully before deciding or before thinking, which pathway do I go into, right? Which pathway am I going to use? So, but think about what pathway you're going to use. Also think about what's the local market around you. Is our IBCLC saturated in your area, or not? I'm going to say it's not. But thinking about where do IBCLCs provide care? And then also thinking about, well, I have a mentor. How can I achieve getting a mentor? Think about, how does this fit in my lifestyle? There's a course of study that has to happen, serious study, because the exam is serious. So if you want to sit for the exam and you're planning that you're going to get X amount of clinical hours, what does that look like for you? How are you going to accomplish that? How will your family feel about hours away, achieving these clinical hours? So really take some time to think about these things. And again, you may want to write these questions down and maybe really start to do your own research as it pertains to you and your journey. So I am going to turn it over to Angela. Thank you so much. Angela, take it away.
Thanks, Sekeita. Great, wise words to consider. Okay, now down to the nuts and bolts of it. Becoming an IBCLC, it can feel a little complicated, but I'm going to break it down and give you a roadmap to becoming an IBCLC. Now, first thing, you're going to need to choose pathway. We're going to come back to this in just a minute. Each pathway has three components. The first one is education. The second one is clinical hours. And the third is getting ready for the exam. So the first component, health science education. It's typical education for healthcare providers. To someone who put in the chat, do you need to be a healthcare provider to be an IBCLC? The answer is no. However, you do need to take certain courses. So there are 8 post-secondary or university level courses and 6 general education subjects. You can find a full list of each of the 14 subjects on the IBCLC or the Commission's website. You can search for it or find the link in your resource document, which is attached to this webinar. The 8 university level courses are, and you don't need to write these down right now, are biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally, sociology or cultural sensitivity or cultural anthropology. They can be online or in person as long as the institution is accredited to provide the learning. If you took any of these courses during your college career, they count, even if it was 20 years ago. LER partners with Union Institute and University and Walden University to provide the basic courses. Both organizations are online. The advantage of working with Union is their program director is an IBCLC and has chosen the college courses which meet the IBCLC requirements. If you want to get your bachelor's degree in maternal child health with a concentration in human lactation, take a look at Union. Another advantage is both universities will accept federal financial aid. The 6 general education subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics for health professionals, universal safety precautions, and infection control and basic life support. 5 of the 6 general education courses can be taken through LER. The only one you'll need to search for is basic life support. In many countries, there is an in-person skills check for this training. I've heard of some organizations providing this training completely online. Check with your local resources. In the resources document, there is a link to the Health Sciences Education Guide. The guide provides general descriptions for typical courses in the subject area. Please keep in mind that the IBCLC is international. The names used in their document to describe the course may not exactly fit the description of the course at your accredited educational institution. That's okay. IBCLC uses broad terms with the understanding that there is no universal description for what a course in, say, clinical research will cover. Why are these 14 courses required? The IBCLC is a standalone credential, meaning you do not need another certification, degree, or license to practice to be an IBCLC. Once you pass the exam, you will be an allied health professional. The courses will help you to be prepared for your career as well as help you pass the IBCLC exam. The second thing you're going to need is lactation-specific education. This is where LER has you covered. The education should be comprehensive and cover the IBCLC detailed content outline. IBCLC requires at least 90 hours of lactation education, and then there's 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. The third component is lactation-specific clinical experience. This can be in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding families. Also, it includes lactation assistance to pregnant and breastfeeding or chest feeding clients and lactation education to families and/or professionals. These hours are to be obtained within the 5 years immediately prior to applying for the exam. How many hours do you need? Well, that depends on your pathway. Pathway 1 is for health professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organization. Now, healthcare professionals include physicians, nurses, midwives, dietitians, physical therapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER, La Leche League International, and the Australian Breastfeeding Association. As of this presentation, there are over 40 organizations that have applied to IBCLC and are approved. Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university. Their education has both didactic and clinical components, and they require 300 clinical supervised hours working with breastfeeding families. Pathway 3 is a structured mentorship program between an IBCLC or IBCLCs and the applicant. They must be in good standing with IBCLC. Those who choose this pathway must have their program approved by IBCLC prior to beginning their clinical hours. Now, I understand this is happening relatively quickly, like within a few weeks. So for a quick note, for those of you who may have breastfed or chest fed or provided human milk for your child, the hours you spent nursing, pumping, and helping your friends does not count towards your clinical hours. While 500 or 1,000 hours seems like a lot, there's a good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. If it's any consolation, the number of hours used to be a lot more. I've known IBCLCs who needed anywhere from 2,500 to 8,000 clinical hours to sit the IBCLC exam. Candidates who are applying for the IBCLC exam through Pathway 1 need at least 1,000 hours. For the candidate who is also a healthcare provider, the hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBCLC recognized organization, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. The hours need to be counted on an hour-by-hour basis. Now, 2 important points about clinical hours. It's important for you to document your hours as you accrue them. Be detailed in case IBCLC chooses to audit your application to take the exam. They may want to see documentation, such as a spreadsheet or some other document where you counted your hours. The 1,000 hours do not need to be directly supervised. That's the second point. Now, Pathway 3 requires 500 hours of clinical experience. It's best done in a busy practice setting where you can work with many breastfeeding, chest feeding people and those providing human milk for their babies each day, such as a hospital or clinic setting. The hours count towards the 500 only when you're actually working with families. Observation hours do not count. Clinical experience is graduated. That is, it starts with observation, then doing tasks under supervision, then completing tasks independently with the IBCLC nearby to ask questions and discuss situations. LER has an internship program with many sites around the US. Reach out to support@lactationtraining.com and we can connect you with our clinical internship director, Amy, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. One thing that Amy wanted me to mention in this webinar is that you can't start to count your hours towards the internship requirement until both you and the IBCLCs are comfortable with you working independently. Most interns will spend about 75 hours in orientation before you can begin to accrue the 500 hours. Or you can take a look in your community to find a willing internship site or mentors. You may need to reach out to several people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through Pathway 3 to find successful strategies with finding that good mentor. Now, while this pathway has an additional step or 2, is it worth it? It is. IBCLC reports that students who come through Pathway 3 score best on the exam. I believe it's that mentorship component that is key. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. Now, a lot of people are asking whether or not they can accrue clinical hours via telehealth during the pandemic. The quick answer is yes. The longer answer is paraphrased from IBLCE documents dated 17 April and 6 October of 2020, right in the beginning of the pandemic. IBCLC will allow the use of technology if certain parameters are met. You will need to pay attention to privacy rules and the Code of Professional Conduct and clinical competencies for IBCLC. Another important point is that there should be observation using technology with two-way synchronous audio and visual components. The focus is on the mentor providing the mentoring and guidance to the applicant. Now, this guidance has been extended until 30 September of 2023. It's important to read all of the IBCLC documents listed in the interim guidance. The link to the guidance is found in the resource document in the handout section of this webinar. Now at LER, there are two ways to gather your lactation-specific education. One is the Lactation Consultant Training Program, which is the full 95 hours front to back. The other is either core or bridge. They are designed to meet your education needs depending on your background and previous lactation training. First, we have a comprehensive course called the Lactation Consultant Training Program. LCTP is a 90+ hour course which is eligible for CERPS, CME, and nursing contact hours. It is intended for those who do not have any lactation education and know they want to become an IBCLC. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices such as your computer, tablet, or phone. They're optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We've updated our course information with the latest peer-reviewed evidence on a regular schedule, but we do update sooner as new evidence emerges. Have a question for the instructor? You can send an email to our support forum, and we have IBCLCs available to answer your questions. Want to discuss a concept with your fellow students? We're discussing innovative ways for people to connect. Stay tuned for more information. Upon completion of the 95-hour course, you're eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you're a Certified Breastfeeding Specialist. This is to recognize you for the level of education you've attained. With this certification, you can begin to collect your clinical hours towards the IBLCE exam. Now, if you're not sure where to start, or you already have some lactation-specific education hours, then we have our core or bridge programs to meet your needs. They have the same advantages as the LCTP course. Our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52+ hours of online education. It covers the basics such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is a Certified Breastfeeding Specialist exam. Our bridge course is ideal for people who have the basic lactation education components and need an additional 45 hours to qualify for the IBLCE exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. Not sure where to start? Well, if you're new to the profession, I would suggest the core course. Get your feet wet and see if becoming an IBCLC fits. Our 90-hour course, as well as the core and bridge courses, are available in Spanish. Capacitación en Lactancia is our new website, which provides the same high-quality education found on LER in Spanish. At LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may not make the cost of lactation education accessible. As part of LER's commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In alignment with our continued commitment to diversity, LER is proud to announce our Rising Tide Lactation Equity Scholarship Program, designed to increase the number of Black and Latinx or Hispanic IBCLCs in the United States. We recognize one of the greatest obstacles to entry into the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for Rising Tide Scholarship awardees. We alternate these scholarships each year. You can find out more information on our website, lactationtraining.com/rising tide, or keep an eye on our social media. We'll announce when the application is open. Our team is here to help you now and in the future. We have tech support open 7 days a week. Get your questions answered about the content by experts in the field. And we provide ongoing support for the next steps in your lactation career. Last week, someone reached out to one of our instructors with a question from her own practice. We made the connection and the former student received the answer to help their client. Another student had a question about creating a policy at their hospital, and we found the appropriate instructor to answer the question and provide additional resources. We're all here to help you to support your journey. Now, in that vein, I'm assuming that we have a few questions for today. So, Sekeita, anything pop up that we need to answer right away?
Yeah, the first question that popped up that we need to answer: how can an IBCLC offer consultations online? How are pricing established? Is it based on experience and that individual? So I'll start with the telehealth. Some IBCLCs do provide telehealth, and they were providing telehealth prior to the pandemic. If I'm being honest, there were lots of pilots that were happening about what do clients, are they okay with telehealth? So telehealth is one of the options, which is an online option. As far as how pricing is established, it really depends on where you are in the world about, and before I even say that, I want to say that telehealth is great, but in certain areas, rural areas sometimes the bandwidth does not, this it is not good for telehealth. And telehealth is a skill in itself. So if you were going to do telehealth, I would recommend that you have done a few before you start to charge people whatever the fees are that you're going to be charging. And remember, I said market analysis. You know, depending on the cost of living wherever you may be, even in the United States, it's going to be different. And so I would say look at the area around you. You know, you might even research lactation consultant jobs near me and kind of get a sense of, you know, what lactation consultants are being paid. So yeah, I think, Angela, do you have something to add to that?
No, but as far as, offering, telehealth, absolutely, you can do it. Also offering any sort of virtual support, it can be done. It's just, as Sekeita says, it's important to be able to, it's really, I think, important to have done it before and to be able to feel comfortable with it. For example, that's how I started my career. It was in-person support groups, but also it was telephone help. And so that's initially how I got started. So being able to triage, being able to ask the right questions is something which is important when you don't have the person standing in front of you and you can't necessarily see them. And someone asked the same question, also talked about pricing. Again, that's that market analysis. I don't know if you just answered that, Sekeita, but again, it's that market analysis. What do people make, what do lactation support providers make in your community? Are all of them IBCLCs? Are they CBSs? What sort of certification do they have? And so again, networking. And don't be surprised if people are a little reluctant to answer your questions because they're concerned about competition. Yeah. Frankly, I think there's enough for all of us. There's plenty of families who need support. And so I think there's plenty for everybody. But in some areas, especially in some rural areas or some remote locations or those which don't have a lot of lactation support, then indeed, it may be challenging to find some of the answers for those questions. So you may just have to trial and error it, give it a shot and see what helps. That's how I did it when I started my private practice.
Yeah. I'll have to say though, telehealth, because I started out seeing clients in an outpatient setting and in a hospital setting. And so when the pandemic came, I actually still preferred to go in, right? But there were some clients who just they wanted telehealth. And I'm like, okay, I will say, and we're talking about realities, right? So I'm going to just tell on myself for a minute. I was always left the telehealth prior to this year being like, oh, I don't know how that went, but when the last few telehealths I've done, I've been like, yes, yes, because although I've done this work, telehealth was new. Having the client to angle the camera or have someone there discussing lighting, you learn a lot of things um, about how different consults can be when you're in person versus when you're not in person. Even how to angle my camera, right? So, like, you can see me now, but what if I need to teach positioning? I had to learn. I used to stand up with the dial and all this other stuff. All I had to do was just do this, right? Just to my left, right? So I'm telling you, I'm grateful for the experience. I still prefer in home, but don't offer the services. And this is what my point was, is if you can't deliver and if you haven't worked out all those things and the client is not prepared, telehealth requires that the actual client and their family is in a well-lit area, that they are maximizing, they're in a house where they have a good connection. If not, that's going to be a long consult, right? And so there's all these little I would say nuances, but that are essential to that time that you're spending with the family, because you don't want to complicate and make it harder for that client who've already sought you for assistance. And now we're on this telehealth thing and none of us, we can't get right, right? That is it's actually a skill in itself. And so I just want to add a little realness to that piece, because I was struggling for a few years. I just mastered it. So
Yeah, exactly. I mean, it just depends on, and for example, I know other lactation consultants who are working almost completely virtually now, and they, sort of send the parents certain things to consider prior to, right? If the parents want the lactation consultant to watch a feeding, well, it's helpful to time it when the baby might be hungry, and not to give the baby, not to feed the baby right before. Right? If they are mostly in their bedroom when they're actually, nursing the baby, then is there, as Sekeita said, is there enough lighting? And so having a separate person there to be able to hold the phone is something which is necessary, as well as someone who can someone who can actually hold the camera and take notes. The lactation consultant usually does follow up with notes following the visit, but just in case. So,
yeah,
so
yeah,
is there something
yeah.
else with
Go
that
ahead,
question,
Angela.
Sekeita?
Yeah,
No,
go
I was
ahead.
going to move on.
Um, no, I was going to add one point before I read this
Please.
next question. Point being is that one of the things I didn't mention about realities in the pandemic is that yes, we had to pivot, and yes, we still have to operate safely. And so LER, we do have a way to triage if it's safe to go into a home, and some of the things to consider when you're going into the home in this space of COVID, SARS-CoV-2 or COVID-19. So just want to be mindful of those things too. But I'm going to move on to the next question, Angela. It says, do independent practice IBCLCs need malpractice insurance?
I think that
Did you
depends
want to
on your
go,
level of,
Angela?
well, I just want to say it depends on your level of comfort, right? In other words, if you reside in the United States, many of us are aware in the United States how litigious our culture is. And therefore, it may give you some peace of mind. So is it required? IBLCE doesn't require it. Even we don't require it for CBSs. However, it's really important for people to feel comfortable with the level of exposure, and our legal and ethical concerns for the lactation consultant is a phenomenal course that can give you a little bit of peace of mind, as well as some checkoff lists for you to help you to decide whether or not you need that additional coverage.
Yeah.
The next question here, someone is asking and is asking about salaries for an IBCLC, and I think that that is really just, it's all over the map. It really depends upon the location, the locality where the person resides. And so it may be best to reach out to those hospitals to find out. Also, check your state breastfeeding coalition or your territorial or cultural breastfeeding coalition to see if they have any resources. I mean, I could throw out some numbers here, but I don't know if they're accurate for every area. So I'm a little hesitant to do so. Also, that might date me a little bit. I will say that for most folks, you can receive a living wage as a lactation consultant, working, especially if you're working in some sort of a setting where you're receiving a regular salary. If you're doing private practice, then of course the compensation that you make is directly dependent to how much you work. And I know some lactation consultants who will barter for services. If they, for example, need a website, they can barter with a family who can provide them with the website. If they need fresh eggs, then they can barter for the fresh eggs, right? So, I mean, it all depends upon the, it really all depends on the location and what you're comfortable with and what sort of support and what sort of compensation you require.
All right. Angela, the next question. I am a certified lactation consultant since 2021. I work in a busy birth center as an RN. I have all my hours having worked full time there for 15 years. Is Pathway One my best option? So I'm going to start off by, there is a website, the IBCLC website you can go to and figure out as an RN how many of your hours working will qualify for that. You could do Pathway One. I actually had been a nurse for maybe about the same, about 15 years when no, not even that, because I was 25 years. 15, so 10 years I have been a nurse. I did the Pathway 3 program. I wanted to be hands-on. I wanted to get the skills that I felt that would complement my want to be a full-time lactation consultant. And so I think you could do either or. It would just be up to you. If you do Pathway 3, you have to have, of course, a mentor, right? But you could certainly do Pathway 1, but you would have to use the calculator on the IBCLC's website to figure out how many of your hours will qualify as clinical. So I hope that answers that question.
Right, because if you're working in a birth center and 5% of your time is spent supporting breastfeeding families, lactating people, then that you count the 5% of those hours. So, and the key point there is your work as an RN. So if you work as a recognized healthcare provider according to IBCLC, of which a nurse is one, then you can count your hours in that clinical setting. So the certification that you have aside, it's really based more on the fact that you're an RN.
Here's another question, really important question. Do we have stats on the percentage of BIPOC IBCLCs in the US? I know it's concerning. How can CLCs working towards their IBCLC find information regarding scholarships? That's a loaded and important question. And I believe there was a journal article a couple years ago, and it talked about the percentage, but I think it was a guesstimate of percentage. I'm not sure how accurate that was. Let's just say it's a low percentage. Can't remember that number. I don't know if it was like 3 or something of that nature. Angela, do you remember?
I don't remember, but I think, I want to say that I believe that number is definitely growing. In other words, I think that we have made a concerted effort in the past 10 years to provide that sort of, additional supports. I know a lot of scholarship programs, frankly, if an organization reaches out to us and asks us if they can provide one of our courses for their scholarship program, I almost always say yes. And so, as a matter of fact, I'm in conversations with an organization that wants to give away 50 of our 95-hour courses. And so all of that is just super exciting. I don't want to give away the name of the organization. We don't have that agreement yet, but do reach out and you can do a nice search online for those organizations. Also reach out to organizations that you know are serving BIPOC communities. You know, I'm thinking specifically of Rose. I'm thinking of the Indigenous Breastfeeding Counselor program. I'm thinking of those organizations that I know are deeply rooted in the community. Also check with your local breastfeeding coalition to see what they offer. There's a lot of coalitions now who are actually offering scholarships, and they're raising money. They're doing fundraising for it. They're getting grant funds for it. So I agree with you, Sekeita, that the number is low. It doesn't nearly represent nor reflect the current landscape of peoples in the United States. So anything else you want to add?
No, I think we did due diligence to that.
Awesome.
Um, I'm just
Okay.
looking for additional questions. There are some that have not been answered. Let's see. If you're working through the IBCLC detailed content outline and there are areas you need extra study help, does LER offer the capability for a private tutor? I am laughing because I'm not laughing at this question, but I'm laughing because we just discussed this in a meeting. It came up as an idea. And so I was so excited to get the rest of the sentence out. So that's why I stumbled and that's why I laughed. Uh, but yeah, we talked about that at this time. We don't have a program like that. However, we really did just bring this up, Angela. So I'm just like, whoa,
She must have been in our meeting. Yeah. So what's interesting
exactly.
though is that, you know, we have our exam review course. And honestly, that exam review course, it's a really truncated version of the different topics in the detailed content outline, like anatomy and physiology, breast milk composition, or what are things that you need to remember. But also we have a 600 question database, an exam, so you can test your skills against our questions. And the nice thing about that exam, it's called QBank. The nice thing about QBank is that if you have a question, you can actually put it in the comment section and we will answer it. And so we take a look at it in case we're missing some, you know, research that we missed when we actually created the question, the item itself. And so we will go through it and say, wow, you know, this person is stating, oh, gee, there's this new piece of research. This person has popped in there that there's some new piece of research. Do we need to go back and take a look at this question to see if we need to change something about the question? So, I mean, we actually do provide you with, you know, I won't say in real time, it is asynchronous, but we do provide you with that sort of information. Also, you can reach out to support at lactationtraining.com. We have a lot of IBCLCs and CBSs and La Leche leaders on staff. And so we are going to take a look at those questions and we're going to be able to provide you with, hopefully with some of the answers. But find sort of one of those courses like our exam review course that provides you and just kind of go through the detailed content outline and take a look at it and see what areas do you need to focus on and focus on those areas specifically.
Just want to add to that, Angela. Thank you that because a question mentioned private tutor, and I know that sometimes there's different modes of learning for, it's particularly adult learning. And what I would say to that, because I've had folks reach out to me locally here who know me, who are going to sit for the exam, they have reached out for those one-to-ones. Like, I just want to be sure that I'm ready, right? And so what I would say to that is if you develop a relationship with a local IBCLC, that very well is a great idea. I actually had someone reach out to me, and I've had a few people, and this particular person was a gym, and I kept saying to her, "You're ready, you're ready, you're ready." Anyway, she passed that thing, right? There was another person who reached out to me, and I'm like, "Ooh, okay, we're in trouble unless X, Y, and Z," right? And so, in particular, if you are the person who wants that private feedback, that one-on-one, that human interaction, right? think about, who are your IBCLCs, who's mentoring you. And I would say set something up, barter, for their time, to get that private tutoring, because I think that that's so important and it's different for different people. So
The other thing is that you could provide tutoring with each other, with your colleagues. So, for example, when I was studying for the exam, a long time ago, I had a friend of mine who was also going to take the exam at the same time I did. And the wonderful thing is that, she had a couple of books and I had a couple of books, and we would say, okay, next week we're going to talk about prematurity. And we actually mapped out the detailed content outline, and we picked those things that we really felt a little shaky on. And so next week we would do it on prematurity. She would read her books, I would read my books, and we'd come together. And when the books disagreed, we talked about that as far as the why. And so that was really nice to be able to have somebody else, so that we had people to bounce things off of, because even though I'm an IBCLC, I don't know what's on the exam. And so I think it's important to, go with the people that are either in your community or those who you've met online, and see if there's a way that you can have that accountability partner and be able to sort of walk through some of the content in that way too. And to that person who who asked us about the private tutor, any chance, they asked again, a follow-up question, any chance we'll have it available for September? I'm sorry, but no, we just will not have it by September. We're just sort of kicking around that idea. So anyway, someone else has asked any ideas on how to calculate the hours, the percentages worked in women's health towards clinical hours. IBLCE has it on their website. They have a clinical hour calculator. And so if you go on their website, you can find it. There may be a link to it in our resources. Otherwise, it's relatively easy to find on the IBLCE website. I'm sure if you just do an internet search, you should be able to locate it.
there's a question. How do I know what books to purchase? Are they included in the LER course? We have on our website, we have a store where you can purchase books. And so if you're looking at what books, I would do a deep dive and go to that website to kind of look at the books and see what the recommendations are, or what LER recommends. The books do not come with the actual course. So yeah,
There's too many of them. Yeah,
I hope
there's
that
like,
answers.
10 different textbooks that you could get. There's a few that we recommend, and we've actually negotiated with the publisher discounts on all of the books on our bookstore, so, or at least the ones that we recommend. And so please do take a look at the website and see if there's something there. Julie put in as a response to the person, breastfeeding and human lactation and breastfeeding answers. So those are two that we find, covers a majority of what the detailed content outline is going to cover. So
Yeah, there's another question. Any tips on studying photos for the exam? I know that was a concern I had. Where can a student find pertinent lactation pictures? Thank you for doing this webinar. Whew, the infamous picture question. So we will do a 30-day exam review where we will talk about that in a little bit more detail. But what I want to say about pictures are this: it's challenging to get pictures, lactation pictures in particular, because the nature of there's this nature. And for me, I'm just going to talk about me and my practice. I am always hesitant because I feel like in some ways asking for a picture while folks are asking for my care, I haven't reconciled how, like, it feels exploitive, and so I don't have very many pictures, I'll say that. However, when you think about the picture, just note that it's difficult and challenging. The pictures actually come from IBCLCs themselves that have taken pictures when they're out in the field. And so some of the pictures are dated, some pictures are new, particularly as it relates to certain conditions, conditions of the mouth maybe, or even conditions of the mammary tissue or breast. And so think about it this way. If you get a question about a picture, focus on the question, what the question is asking you, and then look at the picture, exactly what the area it's asking you about. But we will take a deeper dive in our 30-day review. But yeah, folks get nervous about the pictures, rightly so. Some of them are dated. Yeah. But it's just the nature of what we do in this work, and the balance that we have to play when we go into homes and folks are seeking care. Sometimes it's appropriate to ask for pictures, and sometimes it's just not. So,
Right. And as someone who has a lot of pictures, because I actually have that on my consent form because I teach a lot, that is something which is still a very delicate conversation, even though I'm pretty upfront with it. But it's still a very delicate conversation because it's a very intimate time, as well as there are some folks who do not, either for a variety of reasons, do not want images taken of them, and especially taken of their mammary tissue, their chest. They're just super uncomfortable with it, or even their baby. So indeed, that's definitely a different conversation. As far as studying photos, we actually have a blog post that I updated recently on how to study the exam, how to study for pictures, and so you can take a look and you can find that on our website. Someone else is saying that the person who has this private tutor idea, Sekeita, is like, we think that 30-day exam review and an hour every day, and that this person would sign up. So that's the nice thing about our exam review course, is that I think it's 35 or 40 hours of content, and it covers each one of the detailed content outline. And you don't need to wait for us to show up online to teach it. It's already there. So do take a look at the exam review course and see if that's something which fits your needs. And Sekeita, can you tell that we're getting close to the exam?
oh yeah, I feel it in my bones. And listen, we're here for support. Truly, 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 we are. So if you
Yeah.
do have questions, please email. No question is off the table. And really, we do this because we want you to pass the test. That's why we do the 30-day, we do the 90-day, because it's important to plan. It's important to plan, and I talk about the 5 Ps. Proper preparation prevents poor performance. And so it's a great thing that if you are taking the exam, that you have maximized the opportunity to sit here today with us, knowing that you probably already have your hours, but you're sitting here anyway. So I applaud you and I thank you for joining us.
Yes, I agree. Thanks so much for joining us today. Please do reach out to us at support@lactationtraining.com with further questions, and have a great rest of your day, morning, or evening.
Bye.